But what I'd like to do, sort of just to level set you all, to really just touch upon sort of 4 big projects that we have ongoing at this moment, and just to give you the big highlights of these particular projects. First, we're extremely excited about our primary non-adherence. You heard Bob actually mention primary non-adherence earlier, and the fact that between 20 and 30% of the prescriptions aren't filled in America. And the foundation actually supported research done by Ole Miss as well as Harvard, and their research is really pretty impressive in that they are saying that the results are showing that pharmacists absolutely and unequivocally improve PMN research on PMN rates. And so we've been working with, as most of you know, PQA to develop that measure and to validate that measure. And a lot of our NECDS members helped us get the data sets to validate that. And we're hoping that that's going to come to fruition this fall. Once that does, we're going to be working, hopefully, with all of you to really get that measure implemented. We'll be working with SureScripts. We'll be working, hopefully, with the government and others to really get that to be an industry-wide standard. So we absolutely appreciate all the help we've received from PQA as well as Pfizer. Pfizer has been a great supporter of this particular research project, so thank you very much for all your support. And for those that want to learn more about PMN research, please join us tomorrow for an insight session. We have Kroger actually giving a phenomenal presentation on how they implemented some interventions, and so we really encourage you to join us in that session. Now I just kind of want to change your focus over to our emerging care model research project. As most of you know, we kind of took the foundation in a different direction the last couple of years. We decided that we needed sort of a new vision for the foundation, one that aligned the foundation's mission and activities with what's going on in healthcare. And as we all know, there's so much, this healthcare environment is so transformational. We just have so much so many moving pieces here. We wanted to make a meaningful difference. And so looking forward, we really wanted to come up with, projects that we thought that could really advance patient health, improve patient outcomes, look at quality of care, and reduce that overall spend. And so in 2012, as you all know, we issued an RFP, and we had over 40 some odd phenomenal proposals that came in from all across the country. And with our very good independent review committee, we were able to whittle it down to 3. And we are absolutely delighted to have 3 emerging care projects ongoing. One is with the Pioneer ACO out in Trinity ACO out in Iowa, with a phenomenal team out there. And many of you, we have Outcomes, and all the local community pharmacies, a part of that network, are involved. And it's sort of like a real-life experiment there in showing how independence and chains can all work together and to really improve patient health and really to take down the total spend for that ACO. So we're absolutely delighted with that project. We also have the University of Nebraska working with Walgreens and the Blues out there, and they're a little bit more targeted in terms of hypertension and diabetic as their focus areas. But absolutely delighted to see the work, the care coordination between that medical home and community pharmacy. And then, of course, we have the project up in North Dakota, which is a medical home by the Blues, the MediQ home, which has a gold standard on medical homes. And again, we're working with Outcomes, Thrifty White, Prime. And so again, we have a phenomenal project there that's pretty comprehensive. And again, looking at how integrated community pharmacy medication services can really drive patient outcomes and how we can reduce total overall spend. So the good news there is that they spent the last 6 months up and running and really ramping it up, and we've got patients really enrolled and in all of these 3 particular research projects. So we are very delighted with the progress, and we hope to be able to report next time we see you on the great results. So, and those in the room, we can't thank you enough. We know it was a heavy lift for those that have been working with us, so thank you. The one that's ongoing, that is sort of what I call open, is the rapid diagnostic testing. And I have to say that we have a phenomenal partner who we've been working with up in Michigan, who has been really helping us pilot this particular research project. And here we're trying to improve patient care with flu and strep, and we're looking at how we can improve patient care, time to treatment, and again, looking at opportunities for population health. And so we've had last year we had a pilot ongoing with a very strong partner up in Michigan having to do with flu. They're going to be able to expand that, this particular pilot to include strep in over 35 pharmacies. So we're absolutely delighted. But we are looking for additional partners. And so I know we've received some interest across the country, but for those that haven't expressed an interest and that, or you don't know enough about this project, please find one of us, myself or Alex or Nick, and let us sit down with you and kind of walk you through this. This is a very exciting project, and we think that ultimately this will really help improve patient care at the community pharmacies. And last, let me just touch upon real quick our notice, the Foundation's recent notice, RFP notice, having to do with transitions to care. We haven't been able to walk down the hallway without someone stopping us saying that they're really very encouraged and very excited about this RFP, and we are too. So we are looking forward to receiving a number of proposals from you all with respect to this transition of care RFP. And of course, it's really to take the opportunity to evaluate the integration of community pharmacy in transitions of care models. We're being extremely flexible in terms of what models we're looking at. It could be a blended approach. It could be that you're working with a hospital partner and their pharmacists are going to walk that patient to the door, and then the community pharmacy and the organization is going to be picking them up on the other side. It could be that the community pharmacy is embedding folks into a hospital setting. It could be that we're using telehealth. Again, we're trying to be as broad as possible and provide you with the flexibility to come up with a very innovative care approach, one that makes sense from your own business models, and also one that will ultimately improve patient health here. So as you know, whereas this RFP is open until September 20th, and so we really do encourage you to get your proposals into us, and the amount for each grant will be up to $600 each. So again, on this, if we could, we're really looking for very strong research teams and looking for collaboration across the care continuum. So medical, the medical community being involved, having physicians, at the same time getting good colleges of pharmacy to play along, and also you all as associations. So again, we're around and we appreciate the time and your interest in what the Foundation is doing. And let me just end by saying, we can't do it without you. We can't do it without your support. We can't do the work we're doing without your participation. And all I can say is that, we're just delighted to be able to work with you to advance patient care and, and population health. So thank you.